Hi, my name is Davis Cho, and I will be demonstrating oxygen therapy, and we are in the SUA ambulance.
Hi, my name is Alec, and I'm going to be the patient.
Okay, so this is an oxygen, and we have different devices to give the oxygen to the patients. Now, the first thing we do is scene safety and BSI. BSI stands for body substance isolation, so I will be isolating myself from harmful things that the patient could give me with gloves. Now, the first thing we need to know about giving oxygen is to secure the oxygen tank. So you never want to leave it standing up, but you can leave it horizontally to the floor or on the ground, or usually just strap it in the back of the stretcher here. Now, the first thing you want to do is crack the tank, which means getting a little bit of oxygen out, and the oxygen should come out through this hole right here. So I'm going to crack the tank, got rid of some of the dust. And the next thing you want to do is put on a regulator, and this regulates how much oxygen comes out of the oxygen tank. So you can see there are two prongs and a middle valve where the oxygen goes in, and you just want to match it up with the oxygen tank. So there's two prongs, and you want to bring them down. And once you do that, you want to open up the oxygen tank. So righty tighty, lefty loosey. And right now this oxygen tank is at 2000 psi. And the bare minimum is 1000. Once you hit 1000, you want to replace it. So this is how you control how much oxygen comes out. And if you want to hold on to that, Alec. Now there are 4 different types of oxygen therapies that we could give: the nasal cannula, nebulizer, Non-Rebreather, and the back valve mask, which all have different flow rates. For today, we're going to be going over the Non-Rebreather. Okay. So first thing is you want to choose how much oxygen is coming out for that specific oxygen therapy. So for the Non-Rebreather, we're going to set it at 15. And you can see the numbers right here that matches up with the flow rate. And then you want to attach the oxygen tubing to the end. And as you can see here, that is flowing. Now you want to fill up the bag so it gets full. And once it gets full, I'm just going to turn this off for now. But you want to hold on to that? Once it gets full, then you want to put it on the patient. So these rings here, you want that on top on the nose. And you want to just pinch it right here. And that's how you give a non-rebreather. Now we have all other devices too. This is a BVM mask, and it's every 5 seconds. We have a nasal cannula and a nebulizer. Well, thank you for watching, and we'll see you next time.